Good afternoon to everyone. Thank you very much to be here today. I'm Alessio Gai and I'm the Knowledge Management and Learning Coordinator of the project Bridge the Gap. For those who didn't attend last sessions and therefore maybe know a little less about the project Bridge the Gap, uh, this project is a European funded initiative coordinated by FIAP, the International Anglo-American Foundation for Administration and Public Policies, in partnership with three agencies, European agencies for development and cooperation, the Spanish, the Italian, and the Austrian, and two international NGOs, the International Disability and Development Consortium and the European Disability Forum. The initiative aims to contribute to the socio-economic inclusion, equality and non-discrimination of persons with disability through more inclusive and accountable institutions and policies. In the framework of the knowledge management strategy developed within the project, we built a webinar-based training cycle to gradually explore the different cross-cutting issues taken into consideration by the project action. The webinars are prepared and conducted by global and field experts selected by the Bridge the Gap team. The sessions are prepared to be as much as possible interactive, repeatable, and shareable, and each webinar is conducted in English, French, and Spanish in separate sessions. The first session of this training cycle was an introduction to the UN Convention on the Rights of Persons with Disability. Then the second was about the Sustainable Development Goals, and the last one was focused on disability inclusive development. For those who missed them, you can find videos, the recording of these first three sessions, together with the transcriptions and the learning materials on the project, on our project website, on Facebook and Twitter pages, and also on our YouTube channel. And you can find the links here also in the chat box in a while. Today we have this fourth session of the training cycle, and it's titled Inclusive and Accessible Project Cycle Management. This is, I think, a really important topic, especially for who works on managing projects, programs, planning and implementing activities, but such as in monitoring and evaluating project phases, etc. Because managing project is a daily activity developed in so many different sectors that the consideration on the disability dimension in the project cycle contributes, I think, to improve the quality of life of everyone in every sector and in every country. The general political and legal framework on disability is given by the UN Convention on the Rights of Persons with Disability that, through the Article 32, promotes the inclusion of the disability perspective in all development policies and programs, and in turn in their implementation mechanism. Building upon the human rights-based approach, ensuring an accessible and inclusive project cycle management requires to take into consideration several aspects like equal rights, participation, accessibility, but also raising awareness and capacity development. The session today is intended as an introductory learning opportunity that covers key elements of inclusive project cycle management to be understood and applied by development practitioners and any other interested stakeholder. To introduce us to this important topic, there is Ola Abu Alghaib, the Director of Global Influencing and Research at Leonard Cheshire. Ola takes the lead in implementing the ambitious strategy for Leonard Cheshire to become the global partner of choice in disability, while significantly growing advocacy initiatives and partnership with key domestic and global actors. Ola represents Leonard Cheshire as a board member at the Global Disability Innovation Hub and at the International Disability and Development Consortium, one of the Bridge the Gap project partners, but also at the Brand Disability and Development Group and Together 2030 Global Initiative. She's also a board member of the Disability Rights Fund. She has been a member of the advisory bodies to support governments and social policy reform, and recently involved in providing technical expertise around effective reforms towards inclusive social protection policies. Last but not least, Ola represents IDDC in the project Bridge the Gap in our steering committee. Before starting, just a couple of technical tips. The webinar is live captioned, and you can find the link to follow the live captioning here in the chat box. As well, you can find also the link to our communication channels. I give the floor to Ola. Thank you very much. Ola, sorry, can you turn on the mic? Thanks.
Oh, sorry. Thank you, Alicia, for the kind introduction, and thank you everybody for taking the time to be with us today. I mean, I'm very enthusiastic to see the high number of people attending this session, and I hope you will all finding it useful for you in your day-to-day jobs of translating the commitments of what does it mean to have an inclusive project cycle management. Maybe to start with is just to discuss why we think it's important to have an inclusive and accessible project cycle management for disability. And the answer is very simple, is that all our day-to-day development and policy practices rely on such mechanism to define where we want to go towards our commitments, whether it's a government, a ministry, or a practitioner on day-to-day work, or it's a program led by development actor, or whether it's a donor who wants to put forward commitments to change realities on the ground around most marginalized communities. And that's why it is very timely and important to discuss thoroughly what would that look like when it comes to disability in terms of inclusive practices. Maybe to start with, I know Alicia touched upon the CRBD as a framework and as a supporting mechanism to this principle, but I would like to come back to that specifically, explaining that 12 years ago when the convention drafting took place, there was a lot of discussion and agreement globally on the importance of defining an article that looks at international cooperation. And the reason behind that is due to the learning from the previous practices that without the right resources and without the right support, we actually will fail in terms of putting that global ambition into realities. And that's why today we are celebrating more than 176 countries ratifying and adopting the convention and putting those commitments and principles into practice. We are also celebrating that there is an increased high volume of commitments from global development actors supporting disability and development practices. And a lot of that comes to the fact that Article 32 in the Convention spells out very clearly the importance of international cooperation. And it's very important to come to that article and explain a bit in details how did the convention envision that would look like. So it's not just a matter of putting money on the table to support disability. It's really ensuring that there is coordination and collaboration, so there is no duplication between actors working in supporting programs to support disability inclusion. But also there was the importance around capacity building. And capacity building and understanding what does inclusive practice look like. It's not just a matter of others understanding, but also it is within the space of those donors of trying to have a deeper understanding what would that look like. Because project cycle management is a requirement also by donors for grantees to follow a certain type of structure of management and reporting and monitoring and evaluation. And if disability is not seen as a cross-cutting vision on all of that with clear understanding, what do we mean when we say this project is inclusive to disability? There has to be a deeper understanding around that, because if we fail from the beginning around this, then the whole steps in the future to take that program forward will fail completely. Also, the article talks about facilitating research and understanding the evidence side of, again, what works around this effective international cooperation when it comes to disability and development. And of course, this issue of assurance that equity is also a key principle when addressing those issues and when supporting them in the targeted countries. Another relevant and key success and achievement framework for us when we look at inclusive practices, inclusive project or program cycle management is the drafting and adoption of the Sustainable Development Goals. The Sustainable Development Goals spells out very clearly that the ambition is by 2030, no one is left behind in terms of core issues that are of principles for each individual human being in anywhere around the globe. And for this promise to happen without inclusive practices, this is not going to be achieved, because we can't rely only merely on saying disability specific programs will solve the problem. Mainstream development thinking is very key here to ensure that whatever we are working around in any country across the globe, whether it's water and sanitation, whether it's health prevention programs, whether it's social justice issues, disability should come in as a predeterminer. And we need to make sure it is built in across all the steps of the cycle to ensure we are equally addressing the issue, equally ensuring we're capturing that change. And of course, we know that inclusive practices are important, specifically for persons with disabilities, additional to other marginalized groups, because there is a clear evidence out there about the connection between disability and poverty. We know that disability causes poverty, and poverty could cause further illnesses and impairments that could leave individuals with permanent disabilities. And to come out of that vicious circle, development interventions need to step in more fiercely to ensure that poverty is addressed, but also disability is considered when we are looking at poverty alleviation programs. Because unfortunately, again, until now, programs related to poverty alleviation, they don't look consistently to disability and how those programs are sensitive, are directed to influence members in the households that have certain impairments. And I have been involved in massive research that looked into those practices. So this is again why we need to look more in details about our program cycle management in a way that looks into disability, because without that, we're leaving millions of people behind. We are failing to equally serve and address the needs of every individual in the communities we want to serve. So defining inclusive development, of course, there are many interpretations out there. What do we mean by that? But in principle, it is the equality of opportunity and the equality of impact on individuals. I don't want to complicate it with all these, lines and lines of interpretation, but for me, as I said, every individual has the right, every citizen out there has the right to have equal access to all relevant services and have the right to be equally benefiting from those services to the directions where he or she sees their life wants to be. And this is again a very basic question that we need to have in mind in any moment we are thinking or designing or strategizing future development interventions. Are we really thinking equally to target audiences where disability is at stake? What do we need to do to ensure they are equally accessing those programs? What do we need to do to ensure they are equally benefiting from those programs? And of course, the core principles that looks across the whole program cycle are four principles for me. It is the attitude, because remember, the power lays on the individual. If I am a program manager, if I am a senior person at the donor space, if I am a policymaker who wants to start designing these programs, this is where it's the starting point of decision making, whether disability comes into the discussion or not. So attitude and behavior and assumptions about disability are key because they influence that direction, and that's why it is a core area to consider organizationally when we are looking into being an inclusive practice organization or structure. The second one is about communication, because the way we communicate about disability differs, and the more rights-based we are, the more inclusive we are, the better it is that it reflects into our understanding and behavior and attitude. And that is again a key principle to look into when we consider inclusive development practices. The third principle is, of course, the accessibility. How far did I look at, the accessibility considerations in my program design and implementation and monitoring and evaluation? We will talk about that later in details. But the center of all this discussion, and if we miss that, we have missed the whole understanding of this inclusive practice, is the participation of the people at stake. We have to acknowledge that for many people still they don't understand what do we mean by including people with disabilities into inclusive practices. They don't understand disability. They think it's too complex. They think it requires, expensive resources. It needs certain expertise that those organizations can't afford. And this whole wrong assumption can be solved through one simple principle, which is the consultation and the active participation of people with disabilities on those processes. The simple thing is you go and ask people. If I'm designing an education program, I go and understand the barriers related to students with disabilities, talk to parents about it, I talk to other actors, and then I can sense it. But the relevant actors on this are people with disabilities and their representative organizations. The convention was very clear stating that engagement of DBOs in the process and whole relevant processes related to them is a key principle. We can't ignore that. And this is something that we can't, put on the side of any discussion when it comes to program or project cycle management. Also, one key thing to consider as well as one of the relevant frameworks, and the question, and still it's debatable in many spaces, what do we do around disability? Do we design disability-specific programs, or do we just include disability within the wider mainstream interventions? And there was a clear answer to this question many, many years ago. which is the confirmation of the twin track approach that states clearly we need to look at both sides of the story. We need, within the mainstream programs, we need to ensure that disability is a cross-cutting thing, but also allocate specific interventions that brings and ensures the active engagement, the equal access to people with disabilities in that mainstream program. But also sometimes we need to design those disability-specific programs because there are some specific programs that are tailored to the needs of people with disabilities that still are equally important. But when it comes to mainstream development interventions, we need to look at both sides of the twin track approach. We need to ensure, for example, if I'm looking into, again, coming back to the example of education program in certain countries, the whole program needs to ensure, reach and impact of learners with disabilities. But to ensure that happens, we need to ensure that, there are programs, interventions supporting parents' understanding about the rights of their children, engaging those students with disabilities with their non-disabled peers to advance their self-esteem, working on the community around this, advancing teachers' understanding on disability. So these are still seen a bit of disability-specific interventions, but without them, we can't ensure that all the planned cross-cutting interventions for all students will be useful and equally impactful to students with disabilities. Another question comes to mind for us is who's responsible? Who do we put accountable anywhere to say that they are in charge of delivering inclusive programs or inclusive development practices? It's actually everybody, because it is the disability-specific organizations, it's the mainstream service providers, it's the government, it's the development actors, it is the disabled persons organizations or DBOs themselves, because they also, their practices and their way of work can show a good evidence about how inclusive they are in terms of, incorporating within their own programs and advocacy efforts the rights of all types of disabilities, whether it's on their own or networking with other DBOs. It's the idea of this unification of and deeper understanding of all the issues related to all members with disabilities. And when it comes to, we know that access to services for persons with disabilities entails quite a complex, collaboration and coordination and engagement of different actors in that process to make it happen. We know in many countries, still most of the government services towards disability are either subcontracted to national or local NGOs, or they are laying or centralized in one ministry, in many cases, ministries of social affairs. And that on its own could, risk the fact that if a government right now, for example, is defining its national action plan around the sustainable development goals, which will translate into development programs. And again, the risk is because disability is not well mainstreamed across all the ministries, then the design of those action plans and all related programs will miss disability. And that's where the risk, for example, lays starting at national level. But equally the case is also for all these major mainstream players that work around and gender, that works around children, services and rights, that works around, as I said, like human rights and social justice issues. Again, all these services, if they don't consider disability as a core principle, it will be missed and many people will be out of that cycle. why we think disability is complex and people are struggling. One of the key issues that we know for a fact is, let's say one of you is thinking to design a program that looks into disability. One of your first starting point of challenges is how to define disability. Who do I need to consider to target or reach in my program that I can consider as a person with disability? And we know that this is a global challenge because even when drafting the UNCRPD, there was a huge debate whether do we define disability or not. If we define it, what kind of wording or terminology we need to put out there. And in the convention, Article 1 didn't come up with a definite definition, but it gave some insight around who do we mean when we say persons with disabilities. And of course, there was a clear confirmation that it has a long, it's the interaction between the individual, physical impairment and the environment and the level of interaction actually, and the barriers that are put out there is actually determines the level of disability you're experiencing. But again, translating that into national policy thinking and practice point of view, many governments and many development intervention designers are still struggling with that point. We know there are frameworks out there like the use of the Washington Group questions to help us get an understanding about the prevalence of disability. There are learnings now emerging about, that they can be a good tool as well to be used for you to understand if you are a mainstream organization, to understand the population you want to work with and the percentages of disability in that population. But of course, beyond that, you need to do further deeper understanding. For example, if you're working on women's rights programs and services, the Washington Group questions could tell you that the prevalence of females with disabilities is 6% in this community. But that's not enough for you because you need to understand more about this 6%. Where are they? What's their situation? Who from them I can target? What is relevant to my program? So, there are levels of understanding that we need to put in place to ensure that, this effectiveness of reach and impact for our, if I use the client or customers or beneficiaries in your own programs. Another challenge that we have in mind and we all know about is the fact that we know that the evolution of thinking about disability changed across the years, but still in many cases we're still struggling and we're moving from one approach or model to another. We know that things started and continue to be the case in many, even at policy debates and discussions, disability is still stuck around the medical model, which is looking at the individual more from the lens of the physical impairment. And that is a core challenge because if we stick to that model or approach, that means persons with disabilities are out of any other social or development interventions, that they are more centered around disability medical programs, and they are out, as I said, on anything that relates to their other social and political rights and socio-economic rights. We know that the convention and the SDGs brought the confirmation about the human rights and the linkages and the confirmation that disability is a human right. But still, as I said, in practice, we can see many programs that are development projects that are so badly designed in a way that actually takes you back to even the charity model. We have on the ground, and I'm sure you will all speak to my point, that still we see programs on the ground that are looking at disability only in occasions where they are distributing, these food boxes or clothes or these hardly functioning assistive devices, and they remember disability only when it's close to occasions where it's just, serving the poor or serving the marginalized, and nothing beyond that. And that is where, again, there's a huge risk about, and the interlinkages between attitudes and assumptions and the actual practice that people put in designing these programs. In many cases, it may be of good intention, but because it wasn't framed well around the rights principles, still the interpretation of it fails to respond to what we are talking about. So coming more concretely, so what do we need to look at? So I'm a person who wants to look at considering disability in my practice. So what are the key principles I need to look at? I mentioned earlier the issue about participation, and participation of persons with disabilities needs to be across the whole cycle. So from the thinking around what kind of intervention I'm going for or program till the end of that cycle, which is going to the evaluation and reflection and learning for future programs and interventions. The second principle is the accessibility. You can design the most beautiful program that on paper looks great and it should be addressing everybody's concerns and needs. If you miss the disability principle, you immediately exclude people with disabilities. And I'm sure, again, many of you have seen that in practice where, for example, there are huge promising programs where from the consultation phase, they would invite you into meetings where the meeting space is not accessible. So starting with that principle to the high level of spectrum of interventions where they don't consider disability. So I've seen in the field once like humanitarian response where they would distribute food to people in that refugee camp, and actually the food carts that they were distributing were so high and so distant that people needed to walk distances to go to. And for many people with disabilities, it wasn't possible. So it's actually putting them at risk and harm, not the other way around. The issue of empowerment and capacity building, again, to ensure that people have active voice and engagement in those programs, we need to give them the right information, the skills, the knowledge. So when they are around the table, they are actually able to speak up what they believe needs to be happening within that program practice in a way that responds to them and their members' needs. Without that, equality of opportunity and impact will not be achieved. A fourth principle is what we call anti-discrimination or assurance of when we talk about equality of and equity, actually more of the correct term. On disability, we know that disability is not a homogeneous group. We know that there are certain types of disabilities, and each type of disability would require certain additional needs that we need to consider. So without considering that, without considering the additional barriers faced by females with disabilities and girls with disabilities, we're again excluding a high level of number of people with disabilities who we, from the beginning, thought we will be reaching out to. The access to information for me is a very, very key principle as well. Again, on paper, you could design the best program on earth, but actually, if you miss the chance of ensuring that people know about this program, you will fail to reach them, because we need to have this transparency, but also this accessible access to information where people know they have a right to this program, they know they can access it, and know how to maneuver the system in a way to gain from this opportunity that was designed in a way to be reaching them and impacting them. And the last for me, but it's also equally important, is the do no harm, because in some programs we assume we are inclusive, we assume we respond to everything, but actually we need to be careful we're not putting people at risk, people with disabilities specifically. And one example is that we are working on programs that support inclusive education for girls with disabilities. And we have learned so many years ago is without a clear component in the program to ensure that there are clear protection mechanisms for those girls from violence could put them at risk of, even if it's on the way to school, in the school setting itself. And that is again something to be considered if I want to ensure that I am, responsive but equally benefiting everybody I'm designing or aiming to design the program for. We talked at the identification phase, which is sort of my starting point to design a program. We said it's a core thing to have persons with disabilities in that stage. We also said we have to be careful how to identify people with disabilities. There are so many tools out there. It's just a matter to ensure that I have that in mind when I'm doing this baseline assessments to ensure did we have questions related to disability? Are we asking the right people? Did we ask the specific considerations around the needs that people with disabilities have to be equally targeted to have a deeper understanding? We need to consider also in that space, where am I implementing my program? Because if I'm implementing my program in rural areas, it's not equal when I'm implementing it in urban areas. I need to consider the wider context. I can't assume if I design a program around, let's say, social protection and transport is at stake, I need to understand the enabling environment. Are they present for persons with disabilities to reach those services that would provide support or not? And if they don't exist, then the identification and the assessment phase would help me have those considerations in mind. And also when I come to this design phase, I need to think who, the external environment, but also the internal environment. What I mean by the internal environment, who from my team is going to manage the program? Do I think that they have the right understanding around disability, or do I need to build in capacity building to them because they are the ones that will be ensuring effective implementation? So I need to embed that in my thinking and in the design phase. Financing is another key component about design to ensure that it's inclusive program, because if I don't consider, again, the additional types of activities I want to do that are related to disability, the additional costs related to disabilities that people with disabilities needs to pay to reach equal levels of service to others, that will be missed. And then I will not be able to consider that. Coming back to the example of meeting spaces, if I don't consider disability in the costing of those meeting spaces, I will end up with a very limited budget that will not allow me to hire venues where people with disabilities can come to. So this is again a very key principle to look at across the program, but specifically when designing the interventions, but also when I am financing or allocating the financial resources to that design. And I also need to think about partnership. We talked about engaging with DBOs across the program cycle. But again, how do I want to ensure that effective partnership and this empowerment and inclusive access to information and awareness? DBOs can play a core role around that. So considering partnership with DBOs in that inclusive development practice is key from the beginning for me to get that deeper insight. When it comes to implementation phase, again, we have considered all the things on paper, but now when it comes to practice, at my early stage of implementation, I need to have this reminder to myself, to my teams, to the partners who are in charge about the implementation about disability. So, okay, on each of those types of interventions, how are we going to look into disability? It's equal when we are looking at gender issues and equality around that, but this would require, as I said, an informed discussion from the beginning and continuous, reflection around that across the implementation will help a lot to generate the learning, and hopefully the expectation from donors is also to have the flexibility for you to adapt your interventions if they are not working for persons with disabilities within that space. And that is key, and we know that unfortunately not all donors allow that, but that is a key consideration also to keep in mind in case we want to consider that. Within the monitoring practices, again, there are different ways and modalities of monitoring, but we know that we want to capture qualitative data that would give me this reflection from the individualized experience, which can, of course, be captured with people with disabilities through consultations with the DBOs, consultations with individuals themselves, having case studies, having stories of people, reflection, having clear accountability and beneficiary feedback to allow them. That is very accessible. That's also always the challenge. You would have a nice accountability mechanism, but actually in many cases it's not accessible to users with disabilities. And also equally around the monitoring space is, we know at the design phase, across all the program design, we have defined indicators that will determine my success or failure in that program. And we need to make sure that disability is a cross-cutting. And sometimes we need to build in disability-specific indicators that will help me generating that learning and understanding. Am I close or far from my ambition and target when it comes to look into equally impacting persons with disabilities? Of course, there is also the quantitative part of the monitoring, which is usually done by surveys. So again, in surveys, we know for a fact using the Washington Group questions will again help me get, top line understanding of how many people did I reach. But on its own is not enough. You need further questions in those surveys to have a deeper understanding about, did people actually access the activities, what they think about it, what worked, what were the barriers, etc. And when it comes to evaluation, which is the last, pillar or block in the program cycle management, of course, in that one, it's very key again to have a dynamic participatory evaluation process that we can generate the learning and the recommendations moving forward, not just criticizing the failures, but more to inform the organizational learning. How can we improve our practice in the future around our development interventions? These for me were the key principles that I wanted to share with you today, but I'm more than happy to take questions in relation to what I discussed.
Well, thank you very much, Ola. Now we can start with some questions. I'm sure you have lots of questions for Ola. You can text the questions here in the chat box, and I will read them one by one. Or you can also virtually raise your hand, and I will give you directly the floor to make the question directed to Ola. If in case there are some problem with the connection, just giving you the floor directly, I suggest you to text your question in the chat box. So don't hesitate really to make some question to Ola. Take this opportunity. I have already one first question from Tesfaye. So then ask how we can manage the participation and the right of persons at the initial stage of our development program in a rural area where there is social barriers or misunderstanding towards people with disability. Thanks, Ola, to try to answer to this question from Tesfaye.
Um, as you know, consultation and participation of all community actors in program design is essential, and it's a precondition for all development practices. As I said earlier, there has been always a challenge of, as you said, like, do we actually engage community members with disabilities? Do we actually look into their specific rights and needs in our thinking or not? And in many cases, it's missed. Now, how do we do it in practice? First of all, we need to understand, like, let's say it's a program around water sanitation, is where disability comes into the picture. And the first thing is, if there is no representative body in that community, it's a village, it's in a remote area, that there are no structures in place, but I'm sure there are, people with disabilities living in that community, and usually community leaders or religious figures or, um, heads of municipalities and schools would know those members. And the essential thing is to have them around the table, and to have them around the table on two streams. You remember when I discussed about the twin track? We need to engage them in the wider discussion, but also equally important to have a specific, maybe focus group discussion with them. So let's say the whole community agreed that, infrastructure for the schools is very key. So of course they will be agreeing with that, but then come to them and say, so what does that mean for students with disabilities? When I'm talking about vocational training centers, there may be certain areas of interest for that community to advance the skills of young people, to be able to advance their opportunities in the labor market. But when it comes to disability, I need to meet with those potential employees with disabilities to understand why are they not there, what can we do to ensure they are equally engaged in the programs. So my advice is, first, of course, you define first where you want to work. And second key important is to ensure disability is part of that consultation process. You're doing the consultation, disability is part of it, and you have this discussion around disability within the mainstream discussion, but have a specific one with those members to understand what did you miss or what you need to include to ensure they are on equal basis in your program design.
Thank you very much, Ola. We have another question from Tigabu that asks, disability inclusive development programs lack staff with the relevant competencies. How to match disability knowledge with development knowledge? Thank you, Ola.
Well, as I said, now life is easier. It's much easier than many years ago because, if you go in the thinking before, development comes to mind when you want to change the realities of citizens in whatever context you want to work with, more to ensure that they are enjoying the quality of life they want to achieve. But of course, from that discussion, disability was missed. And to bring those two worlds together, as I was discussing earlier, the global thinking evolved and it's now a great success. Now, how to translate that into community level, into local level, that's global ambition, down to the actual day-to-day program design and delivery is a core thing. And as I said, for me, individually working now for more than 20 years in development practices, looking at disability specific, believe me, it's all about the understanding and the knowledge of the individuals. That's why I really believe the role of DBOs in those contexts is very key, because many people may not know how to look into disability. They may have good intentions and they may not do it, or in a few cases they may want to keep ignoring disability because it's easier for them. On both scenarios, you know, you need to, if you are a disability organization, to put that pressure. You need to put people accountable. There are so many frameworks out there that they signed off on that we need to say to them, you can't, it's not an accepted term anymore that you look into development without disability. And if you need the knowledge, we can offer it to you. Because, as you said, we need to bring the two worlds together. And the only way to bring the two worlds together is to develop partnerships, to show interest, to provide the information, guiding people. And this is the advice, but also to put people accountable. If you know in your community that there is a planning for 30 million program around a certain area of interest to disability, that disability is missed, you need to go there and put people accountable and say, I'm sorry, it's not acceptable. Where is disability from this program? If we are missed, you're missing hundreds of thousands of people. And we know also we need data, and data around disability is still, unfortunately, lacking or weak in progress. So the more evidence you generate as disability organizations around where things are working and where they're not. So it's not always having the stick and saying things are not working, but actually sometimes your role is when things are working, take it and put it out there to show people that it didn't cost much to have an inclusive employment program or a WASH program, or so bring that evidence out there to use it as a way to inform change and ensure that you're building this positive collaboration as well.
Thank you very much, Ola. I don't see any other question. I really invite our participants to make some questions, to really take the opportunity to have Ola here and her time today to go really in deep to this important topic. So I read another question from Daniele. A question to Ola. What are the main operation tools to support the mainstreaming of the disability concept with the development practitioner so that it doesn't become an extra care to pay, but it may support effectively more inclusive action? Really interesting question. Thank you very much, Daniele. I give you the floor to Ola to answer. Thank you.
Well, in terms of tools, there are so many out there, and it really depends on what your level of where you think the missing understanding is. And that's why you need to have this honest discussion with those development actors, is where they think, what do they need to learn more to understand? Whether it is, for example, if they have a certain thematic area of focus, like let's say it's a health practitioner or a health services provider, then we come to them with the starting. I always advise you to start with the convention, because the articles of the convention is sort of our Bible. They tell us the starting point of discussion, what needs to be in place in policy and programs. You take that and you explain it to people. Now, of course, that's not enough. And in many cases, people will think it's so abstract. You need to take those principles and explain to people. So another tool is actually a basic one, which we miss many times, is the etiquettes of communicating with people with disabilities, explaining the importance of attitudes when communicating and addressing the issues around disability, but also all the details about the accessibility requirements. Many people don't know. They don't know that I don't like to be pushed from behind from my chair, because they think it's a good intention to support me move forward. And these are, as I said, small things, but it helps breaking the barrier between what we think is the other side that sees disability as this big complex monster, and coming to it with different approaches. When it comes to policy design issues and program design issues, So for example, about the assessment of who from the population are actually people with disabilities when it comes to understanding, for example, what do I need in place to have an inclusive education practice? What do I need in place to have a social protection scheme that is inclusive? There is massive information out there. We are today in a much better position, as I said, because there are so many guidance notes and policy papers that can tell you, and they are so tangible and practical that you can provide to those actors and explain to them. And if you can't explain to them, you can advise them who to go to bring them the right, expertise and information you need. But you're a central person because you don't know how much you know until you interact with the other side, because the other side doesn't know anything, and actually anything you tell them will be very useful.
Thank you, Ola. I don't see any other question. I really invite you to make some questions, but also to share with us, maybe raising your hand and sharing with us your point of view or your experience on that. I give you just some seconds more. Well, we don't have any other question. I don't know if you all want to just conclude or stress some more points until towards the end of the session.
Yeah, well, from me, thank you again for giving me the space to discuss this. And as Alicia said, there are interesting links for you to look at in the announcement for the webinar to have a deeper understanding that could inform your needs for tools and information. But my final advice to you is I come back again. There are a lot of information out there that you can use. You don't need to invent the wheel. All what you need is, if you are a disability organization DBO member, be out there, be proactive to engage with those development actors that you think are core influencers around the situation of persons with disabilities in your community, because you need to address them at the right moment. As we discussed in program design and management, it's all at the beginning. The importance is the consultation phases, the understanding and the design. If we miss the design opportunity, we missed the whole thing. So it's good to have a deeper understanding about development action plans of the government, development action plans for relevant donors and actors in your country and context, because that's where you can start. That's where you can go to them and say, oh, we know that you're planning to do this. How are you going to look into disability? And offer your support, because that's the only way you will ensure it will happen.
Thank you very much, Ola. So, well, if you don't have any other question, we can say that we arrive at the end of this third session about inclusive and accessible project cycle management. Again, I would like to thank you, Ola, a lot for your participation, for having dedicated your time to us today. I also would like to say thanks to the audience. I sincerely hope that today's session has told something and clarified some doubts about this important topic. Just a couple of last things. The webinar training cycle issues a certificate of attendance only to those whom will attend at least the 75% of the webinars and respond to the satisfaction survey. The 75% of the training course correspond to 9 out of 12 webinars. You will receive the survey together with the webinar recordings and the learning materials in the follow-up mail and at the end of each session. The next session will take place in the second week of December 2018, and it will be about inclusive and accessible communication, another important topic that I really recommend you to not miss it. So, well, thank you very much again thank you to all, to everybody. Really looking forward to see you at the next session. Thank you, Ola. Bye.
Bye bye.